Welcome to this short video on how to hand express colostrum in the first few days after you've had your baby. I'm Treasa, one of the lactation consultants here in the National Maternity Hospital. There are a few reasons why we might suggest that you feed express colostrum to your baby. They could include your baby's not latching and feeding well at the breast when they're due to feed, it's too painful to latch the baby to the breast, or they have low blood sugars. You can hand express every 3 hours for 10 to 15 minutes on each breast. Be gentle and know that you may only get small amounts in the first few attempts. The more you stimulate your breasts, the more your supply will increase. Remember, your baby only needs small amounts of colostrum at every feed in the first few days after birth. So first wash your hands and warm them up a little. Firstly, gently massage your breast from the outer area of your breast towards the nipple in a circular motion. It's important to make sure that you massage all the breast tissue as well. Massage using a gentle fist, a whole hand, or fingers in a circular motion for about 2 minutes. This promotes blood circulation and also stimulates oxytocin. Next, position your thumb and your fingers in a C shape. Place your thumb above the areola and your index finger below, like so. Then gently but firmly push back towards your chest wall. Leave your fingers where they are and compress your finger and thumb behind the nipple, then release. Repeat this action in a rhythmic motion. Push, compress, release, push, compress, release. Your fingers should not be pulling your skin or your nipple forward like this. Also, just to note, expressing should not hurt, so if you feel some pain, try and reposition your fingers and try again. Drops may start to appear now. Continue expressing until the colostrum slows down or stops. Try massaging your breast again to help stimulate the flow of colostrum and restart the push, compress, release action. Push, compress, release. Push, compress, release. You can change the position of the C shape so that you move around your breast and attempt to find that sweet spot for expressing more drops. Push, compress, release. Push, compress, release. So how do you collect your colostrum? You can either collect it in a sterile syringe provided in your pack or another sterile container that you might have. You can either use the syringe like this, push, compress, release, 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 push, compress, release. Or remove the plunger from the syringe, like so. Place a cap on the end securely and express directly into it. Push, compress, release, push, compress, release, push, compress, release, push, compress, release, push, compress, release. Then don't forget to replace the plunger carefully so as not to push out the colostrum. Make sure it clicks in properly so you won't lose anything. Carefully turn it back up, remove the cap, slowly and carefully get rid of the air and replace the cap. And it's ready for storage. So how do you store your colostrum? Once it's in a closed, sterile container, you can keep it at room temperature outside the fridge for up to 4 hours. If you're not going to feed your baby within 4 hours, you should put it into the fridge, store at the back of the fridge for up to 5 to 7 days. We hope you enjoyed this short video on how to hand express your colostrum postnatally.